Glaucoma is an optic nerve disease. The optic nerve is like a cable that brings vision from the eye back to the brain. Most patients that have glaucoma have their eye pressure is too high, and that pressure over time damages the optic nerve. You lose peripheral vision first and ultimately central vision. The symptoms are very minor, if at all, until late in its course. So that's why you have to be screened for it actively. There's a lot of treatments available for glaucoma, but the most important aspect is to get it diagnosed early before the damage is done, because once the damage occurs, it's not reversible.
I discovered I had glaucoma through regular comprehensive eye exams. I did not notice anything with glaucoma because there's no pain with glaucoma, and it's peripheral vision. It's seeing way out here or not seeing way out here, and you don't know that you can't see to the side. It's so gradual.
The two major misconceptions of glaucoma are that there is no treatment, and once you get glaucoma, you're going to go blind. The fact is that there are great treatments for glaucoma, especially if we detect it early. There's medicines, there's lasers, there's surgery that can essentially put your glaucoma in remission. And fortunately, only a small percentage of patients go blind with glaucoma.
The first thing that I did through Columbus Ophthalmology Associates was I just did eye drops. Every night, one in each eye. A little inconvenient because you should take them right before bedtime, and I'm one that doesn't just go to bed and go to sleep. One time I came in, however, for one of my checkups, and my eye pressure was higher than it normally is for me. So Dr. Derick suggested that I have laser surgery, which is a way to open a pathway in your eyes for them to drain better, to drain the fluid out, so your eye pressure is released.
Mrs. Castor is a lady that had visually significant cataracts as well as elevated eye pressure. Fortunately, her glaucoma is fairly mild. And in a lot of folks that have cataract, I think something like 30% of folks that have cataract have coexisting glaucoma. So she was like one of those 30% of patients that have coexisting cataract and glaucoma. She was a perfect candidate for an eye stent because her eye pressures were moderately elevated, but her glaucoma was mild to moderate. And again, she had the visually significant cataract. So after we took the cataract out and implanted the intraocular lens, we placed this catheter into her Schlemm's canal in about a 5-minute procedure at the same time we did the cataract surgery. And this has helped her eye pressure post-operatively. Her pressure is now well controlled, and she's not using eye drops anymore.
It's wonderful. Well, first of all, the cataract surgery was amazing. I could not believe what I could see. The color of my walls were not what I thought they were. Whites were not, they're so much whiter than I thought they were. So I see much better. As for having the stent, I don't use eye drops anymore, and my eye pressure has stayed low. It's wonderful to not have to worry about eye drops. I can go to bed, take my book, read as long as I want, and when I get sleepy, close my eyes and sleep and not have to worry about, oh, I need to take my eye drops. I think it's special because everyone, not just the doctor and not just a few people, but everyone is open and warm and friendly. From the time you walk in at the front desk, there's a smile. I just feel very comfortable and confident that I will be able to see for as long as I live.